Hi, everybody. Welcome back to the program. I'm Ryan McGuigan, and this is the Renewed Life podcast. And today, joining me is Cathy Taughinbaugh, and I hope I'm pronouncing that right, Cathy. I probably spent 20 minutes trying to figure out how to pronounce your
It's
name.
okay. It's okay. It's Taughinbaugh, but you're not the only one. It's not an easy name to deal with. So
The Compassionate Antidote, a path to change for you and your child struggling with substance use. Cathy's passion for empowering parents stems from her own journey with a child's substance abuse. Her expertise is grounded in a science based program with over 40 years of support of clinical research, which she uses to equip parents with the skills needed to motivate and support their teens or young adults on the path to change. And welcome, Cathy. It's wonderful to have you on the program. Your personal journey into becoming a certified parent coach, focusing on helping parents with struggling teens. How did that start for you?
well, first of all, thank you for having me, Ryan. I really appreciate it. It started for me with my own personal family experience. I have three kids, and I have two out of the three that at different points in their life struggled with substance use. So we went through the whole treatment program with my daughter, sober living, all of that. That entails, figuring all of that out. And then my son chose a different route of going through counseling for a long time. And so they both had become, marijuana was an issue, crystal meth was an issue. And I honestly, at the time, was totally taken by surprise, as most parents, I think, when you're not dealing with it, you have no idea what to do, how to handle it, what's the next step, a lot of fear, all of that kind of thing. But as it went on, I attended, excuse me, meetings with other parents, and I learned, some skills that way. And then I really just, the whole issue, I think, just affected me because I just started seeing all these families, and many of the parents were loving parents trying to do the best they could. These were not necessarily dysfunctional families. They were, and even then, I mean, problems happen, but they were mainly parents that were just trying their best. And these kids were using substances, including my own. So after a certain period of time, I'd been a teacher for many years, and I was at the point where I had stopped teaching, and so I just was kind of looking for a project, and really just decided to start a website and reach out to parents, share whatever I knew, just to kind of see where that would go. And then I became involved with the Partnership to End Addiction. They found me. I think I left a comment
Okay.
somewhere, and
Yeah.
so yeah, so they found me, and I became part of their parent program, which was at the time, and this was like 2012. This is a while ago. Doing work with them, and then the next step was I really wanted to start coaching. I thought that would be a nice way. I was kind of behind the computer all the time, and I thought it'd be a nice way to talk to parents and work with them that way. So I was starting my own private coach training program, and then they reached out and said, "Would you like to be part of this craft training? It's community reinforcement and family training that we're going to do with the Center for Motivation Change. Would you like to, come to New York and get trained?" And so I and several other, I think there's 11 of us, parents went. And it was the first time we had ever heard anything along the lines of, helping your child. I mean, I had gone to Al Anon, which had been very helpful in many
Yeah.
ways.
Okay.
I had learned, how to take care of myself, how to, there was, don't enable those kinds of things. But when I went to the craft, then all of a sudden you were given skills. Okay, this is what you're supposed to do. This is how you can talk to your children. This is, or any family. Craft is for any family member. It's not just, but I focus on parents, but it's for spouses or anybody. So I was, like a door open for all of us. Like, oh my gosh, there's another way of doing this, and there's not just necessarily one path. I mean, sometimes certain paths work for some people, but other people need different
Yep.
approaches, So, yeah, so that's how I became involved. And I just, coached with the partnership for a number of years, became involved with the Center for Motivation and Change. And then they offered just a couple of years ago, the invitation to change was just an extension of craft. That they were doing training and certifying people, and then we could start our own groups, so that was the whole point of that. You can become trained in it and you can start groups for people. So I went that route too. So, I've become very involved with both of the organizations over time, they're both wonderful organizations helping people.
So, you in your book, The Compassionate Antidote, you talk about this framework or craft, and there's a lot of people, at least in my community, that are not familiar with craft. So, could you give us a just sort of broad strokes overview of the craft framework itself?
Sure. Craft, first of all, is for family members. So it's for parents, spouses, you might be concerned about your parent, whatever, any family member. And the idea is that, first of all, everyone's different. There's not just one approach. That coming to the problem with more compassion and kindness can really get you further along. Then, for parents, I think a lot of us get into the discipline role, and we want to discipline our kids, or, we start the yelling and the screaming and the emotions, because we're scared. You don't know what to do, and you feel like this is really bad behavior and it needs to be responded with really, parents being upset, that kind of thing. But it helps you just sort of stop. I think craft helps you just sort of take a pause, step back, really look, first of all, at the root of the problem. As substance use is just a reflection of an inner problem that somebody's having. And so it's a way to cope. It's a way to, numb out your issues or whatever you're using it for. So it helps parents to sort of sit back and first, before you start in on what you're trying to do, to help to just try to figure out what the problem is, to understand what your child's going through, to be compassionate about it, and to sort of look at your role too. And we're not blaming parents. I think parents get blamed so much for this problem. We're not no one, it's not there's many wonderful families who have kids with these issues. There's many parents who have a lot of problems and their kids turn out fine. So it just depends, but so it helps to have your parents sit back and kind of look at what's going on. And so that's the one piece. And then the foundation of craft, I'll just zip to that really quick, is really noticing what your child is doing well. And so when children or young people are using substances, all parents can really see usually is, the drug use or the alcohol use and all the bad things that are happening. Maybe you're getting into legal issues. I mean, it's just, or you're getting kicked out of school or whatever's going on. It's all this negativity. So within that, we want to say, yes, there is the negative part of it, but also look at what your child's doing well. There might be some things that you're not seeing. And when they do make some small changes, even baby steps, to notice them, to appreciate them, to acknowledge them, that kind of thing, so that your child feels like, I can do something right. I can do something in the world I can do right. And then that is coupled with allowing for natural consequences, letting your child feel the consequences of their use. Don't jump in and fix everything for them. They're not going to change if there's no reason to. If everything's fixed and life goes on no matter what they do, then there's no reason to change. So it helps. Both of those are really helpful as far as looking. And then there's some real clear communication strategies, which I can go into that too, of how to talk to your children and or a family member, that kind of thing. So that's.
Can you give us a typical example? Because I deal. I'm an interventionist. I'm also a criminal defense attorney. I've been doing that for 26 years, and I've been intervening with people's substance use disorder for 15 years since I got myself, or I was lucky enough to be able to get sober myself, and I have. Been in many, many situations where we have family in complete and utter chaos. And so can you, and a lot of that I always chalk it up to is just fear. And I usually have a mother who has a million questions and wants a million specific answers and wants to know it right now. And then I usually have a reticent dad who's trying to be stoic. I don't know if this sounds familiar too, trying to be stoic. But really internally, I can see that this is I could see that this is a person in crisis, and it's a father who's falling apart internally, and maybe it's that sort of that structure that we men build around ourselves, that we sort of pretend that we have it all together. Maybe that's part of the problem, and maybe you can enlighten us about some examples where you've had a situation like that where it's complete chaos, and you've been able to, I guess, take the temperature of the room down, or a lot of the high pressure down, by explaining to people that, it, because it's a moment of life and death, especially with the amount of
Hmm.
fentanyl that's out there these days. I Back in the old days, I would tell people, we can schedule an intervention maybe in a week or two. Now I try not to do it less than 24 hours, because you could be dead rather quickly. And so, if you could give us an example or two, or of a situation where there was a chaotic situation with a family and a person of care in crisis, and how the craft techniques were able to depressurize that situation.
Sure, and everything you're saying, I totally agree with. It is not, and I'll just say off the top, none of this is super easy. I'm not saying this is just a simple process. I wish, and I've had so many parents say, "Is there a recipe? Are there certain words we can say?" And it's all small increments of change. But yes, I mean, I've had a family who, their child was in and out of treatment. They just continued to relapse. Every time this happened, the father would start screaming. They'd just be in these huge family fights, and they would ask him to leave the home, and then he'd come back, and it was just being this continual revolving door. So when they looked into craft, and we talked about craft and some of those ideas, it was a way to just sort of step back first and say, okay, what's going on for him? So they understood that, what was sort of the situation, and to realize that what you want to do is try to come to the problem calmly. Like, first of all, don't talk to your child when they're high, when they're drunk, when
Yeah,
when
yeah,
you're emotional.
yeah.
Wait, if they come in late and they're out of control, just see if you can get them to bed, and then go to sleep, and then deal with it in the morning. The other thing too that we talk about a lot is planning out ahead of time. At the beginning, it's tough because you just all of a sudden this kind of a behavior appears. But as time goes on, you start to see some kind of a pattern. I mean, it is erratic, as we know, and it's not always predictable, but you kind of get a sense of what's going on. So I think it helps to plan ahead. And so this mom, started planning ahead, started talking to her child more calmly. The dad started to calm down. They noticed if he did anything that was even the remote smallest little positive thing, they would notice it, and it made him feel like, okay, I can do something right. Because even though our kids can get pretty belligerent, and they don't acknowledge how much pain and they're causing themselves and everybody else, they don't feel good inside. They're not feeling good about what they're doing. So it helps to just acknowledge any little thing that they're doing, and then talking to them, a couple techniques for communication, or asking open-ended questions, like trying not to drill them, did you drink last night? Did you smoke last night? But just asking more open-ended questions. How did you manage things last night? Or how did it go for you? That kind of thing. I also like the one of like, how can I help? So letting your child sometimes step up and be the one to let you know what you can, what as a parent you can do to help within your parameters. I mean, there's certain things you're not going to support, of course. So this family started to do some of those kind of things. Another one is really asking your child too, can I have a conversation with you? A lot of times as parents, we come in and this is, we start yelling, or this is what we want to talk about, or
Yeah.
we're talking about this right now, that kind of thing. I love this approach of asking your child, can we have a conversation? Or I have a question I want to ask you. And let them say, yes, this is a good time, or no, it's not a good time. Being a little respectful. It's like knocking on your kid's door if they're living at home. A lot of these kids aren't living at home. I can talk about that a little bit too. But so if your child is living at home, son or daughter, asking them brief, try to be brief, don't give the whole laundry list of everything that's going wrong, or if you have a suggestion or whatever it is. And then you kind of follow up. Does that make sense? Do you have a question? I love that one because it gives, the child really a chance to say, oh, they're I'm getting a little respect, or they care if it's the right time. Because the problem is when we talk through our kids, when our kids are yelling, we're upset, they're upset, you don't get anywhere. You know, a lot of times, you know, parents are just talking right through their children's anger, and the kids are shutting down, and the parents just keep talking, and it doesn't help because no one's listening, or it can escalate. You know, I've had issues where there's, you know, even in this family too, I think the father and the son were in a physical, you know, fist fight type thing. I mean, it can get out of hand. And so
Yeah.
as parents, you want to be the calm one. You want it's your role to be the leader, the role to keep the temperature down. I think the thing that helps too with craft is that, you know, for parents, they're in a lot of pain. You know, as you mentioned, we've got fentanyl, we've got kids, you know, we're losing children, we're losing young people. So to know that you're in a lot of pain, but to also be willing to, you know, I think the temptation is to just isolate and shut down, and you don't talk to any family members, or you stay away from people. Some people will go to meetings, but some people won't. So we want to encourage people to stay connected, find family that you can trust, friends and family that you can trust, so that you're not isolated and just feeling like you're, because it just adds to the stress of it. So yeah, so that family actually, and the son had legal issues too, and he was dealing with that. But they really put these craft tools into practice, and he's doing great now. I mean, it took a while; it wasn't overnight. That's the other thing I wanted to say too. You know, you'll use a certain, like the positive reinforcement or one of these other techniques. It doesn't mean that the next time your child's always just going to follow along the path that you want them to. There's going to be, as you know, steps forward and steps back. You know, there's going to be times, like if they come home sober one night and you compliment them, doesn't mean they're going to come home sober every single night. But you want to start a pattern of noticing and letting them know that there's some positives that don't rotate around substance use. So, yeah. So, and I've seen, you know, parents. I had a family with a 16-year-old. She was ready to kick the kid out of the house. I'm like, you can't do that. You know, I just really am against, you know, those kids are too young for any of that kind of thing. But as she learned more, she realized he was doing things. You know, school wasn't horrible. I mean, he wasn't getting A's, but he wasn't completely flunking out, helping his siblings, doing some chores. And at the end, she was like, okay, yeah, I can work with him now. Getting him a counselor. You know, we talked about that. Needed to get some counselor. He needed some help. So yeah, definitely seen families turn around with this approach.
What age does let me ask you an open question. Is there sort of an age where within parameters that you work with? So I know that you had a 16-year-old. Does it end with, you know, when they're 40 or when they're 30? Because right now I have a 36-year-old with very very tight family, and with a mom and a dad. I won't. Well, the term that's used in the vernacular is sort of helicopter parents that have been around for a very long time and have been sort of stewarding this man or this young man through his youth, and now he's 36 years old, and I have and I had brought him down to a facility last month, and we have a lot of questions from his mother about what happens next. And so, how do you counsel family members, moms, dads, about that very delicate balance of being overly involved and not involved enough?
Right. And that's a big question, and I think it's something that parents face all the time. You know, you're walking a tightrope sometimes. You know, of how one of the things that the craft and the invitation to change, they just try to stay away from the word enabling and codependence, just because they feel like so many parents they feel bad enough about themselves. I mean, they're not, it's not their fault, and that's most of the time. I mean, I would say I've never really met a parent that I could say, yeah, you caused this. I have not seen that yet. And I think most people do, like I said, do the best they can. So, but the idea is you don't want to label people so much. But again, I like the idea of asking yourself every time, and it is a judgment call every time. Am I supporting my child's recovery, or am I supporting his continued use? So you want to support things that will help him continue on and you know, make these changes and continue to progress. So I think too, with a child that's in treatment, I mean, first of all, it's great that he's going to treatment. That's something that you can look at right there. I think also though children do need to be accountable. I have parents too I've talked to, and it's like they're paying for every single thing. The child, they have a car that's paid for. I mean, the apartments, it's like, okay, why would this child change? There's no reason to. So I hear what you're saying. I think children need to be accountable. I think, or anyone with a substance use, once you realize that you have a substance use issue, you need to manage it. You need to be accountable for it. So parents can be support systems. You could sit down and once the child's ready to move out and go from there, you could brainstorm let's brainstorm some ways that we can help you, have your child be part of that. We'll support this. Maybe we can't do that, but and those kind of things. And you can, I think sometimes when people are first starting out, maybe they're getting parents to help them maybe with a month or two of rent, but then you can slowly sort of taper that off, that kind of thing. I agree. I don't think it's helpful to have just continued situation where parents are doing everything, paying for everything, fixing every problem. That doesn't help. So for someone in treatment, I mean, I think craft's great or invitation to change. The groups are great because you really learn. It helps to have listen to other parents. It helps to think about the pain that you're in, and also self-compassion is another big part of it. Parents, they struggle. So, having compassion for yourself, this is really hard. And nobody's saying it's not. It's a really hard situation. But just looking at what can I do to support my child, and really making sure that there's not things that I'm doing that are helping him stay stuck, stay in that cycle of substance use. And a lot of times there does need to be changes. It's hard, I think, too, when young people come home, if that's what they're going to do, come home too soon. And then and I don't know if you see this too, but then you got the friends right there, and it's just so easy to fall right back into it again. So there's decisions like that can be made that it might be painful to have your child away for a while, but it might be the best thing to do, to have them. Like my daughter was 8 hours away for 6 years. I mean, she worked and she progressed on her life, but she didn't come home. And I think she said, if I'd been home right away, I'm sure I probably would have relapsed. So, there's different choices you can make, but I think things like that can be helpful to just sort of think things through a little bit.
Yeah, we around here we like to take people after our interventions sort of out of their comfort zone, and a lot of times we get on planes with our clients because especially with young people, they're so dependent on their social group because after all they don't have a lot of experience with traveling around and meeting new people. So that little group that they have is really the only social.
I can't hear you. Good now. You're good now. Yeah. I think it's
You hear me?
Yeah, I can hear
Sorry
you.
about that.
That's
We'll
okay.
we'll 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 edit Mrs. McWiggin calling me. We'll
No,
edit
that's
that
that's
out.
fine. That's fine. No problem.
So it was, but so a lot of times, or most of the time, I will take a lot of my clients out of state because of that specific reason of getting them away from their comfort zone and getting them away from that group of friends. And what I have found, especially with young people, is I take a lot of them to Florida, and I have a lot of moms who say, isn't there a lot of drugs in Florida? And I said, well, there's drugs everywhere. They're ubiquitous. But what there happens to be in Florida is a lot of treatment centers. And because there's a lot of treatment centers, there's a lot of young people in recovery down there. And so they can start a whole new social network of young, sober people rather than the group that they left behind up in, Connecticut in the Northeast, where it's cold and dark. And so for that specific reason, I like to bring a lot of people down to Florida to a new community. And I'm sure you've seen this as well. A lot of times, what I will get in a family situation is not only do you have both parents who are very afraid. Sometimes we get parents who want to deal with this addiction and this problem in the family in completely different ways. Mom would like to be more compassionate. Mom would like to understand the issue. But a lot of times I deal with dad who is, nope, I need to spank this issue away. And in situations like that, what recommendations would you give in a situation where you have two parents who have very differing ideas about how to deal with this addiction?
That happens a lot. I totally agree with you. It's and it's hard because even if you come to parenting and your children are doing well, you're bringing in from into your parenting your own childhood experiences and what you were, how you were raised and that kind of thing. And then when the substance use hits, it's hard. And I've had parents too where moms are super compassionate, the dad's more, hardcore. And then I've had the opposite too, where the mom's trying to be, let's set some boundaries here, and the dad's, doing it. So what we say, and in the Center for Motivation and Change has a 20-minute guide for parents too, and in that, and I talk about that in my book as well, but collaboration of working with your spouse or partner or the other your child's parent, trying to see where you can meet in the middle, and maybe try. One thing you could do is accept the fact that we're coming at this in different ways, and is there one thing that we could agree on that we could try, even if you try it for a week. Let's just try this approach for a week, and then we'll give your other another approach. You bring in something, we'll try that for a week, something like that, or a month, or whatever it is you want to do. But try to come and see what you could agree on and go from there. One of the things that I think is very difficult is when kids are starting to play one against the other, and I see that a
Yeah,
lot. Where
yeah,
I have one mom that is in one of my groups, and she says, "Oh, he doesn't call me, he calls his dad because he knows his dad. He can always." And
bail them out. Yeah,
and the moms usually are the ones, I think too, I don't know if you have this too, but usually the moms for me are the ones that reach out. I mean, 99% of it are moms. And then when the dads reach out, it's great because I've had a few dads and they're so involved, and it's really wonderful because they do care and they want those conversations, that kind of thing too. But I don't know. I kind of have a sense sometimes with dads that it's just so painful, and I, you would know this better than me, but I think dads feel like I can't fix this. And so it's just painful. And they have a hard time sometimes with feelings, and how can I just get this to go away? Cause I can't fix it. And I feel like that's my role as father of this family, that I need to be able to fix things and, get this family back on track. And when substance use hits, it's really hard because they can't. So definitely collaborating with the partner, and again trying, and again it's not super easy, but just agreeing, we're coming from different places, we acknowledge that, what can we do, what can we agree on for a period of time, and try different approaches. The one thing that I think is key though is you cannot, like I had a parent one time who dad said, okay, the child's not using the car, which the child was using substances, and so I agree, we don't need to be driving. But then the dad was gone on a business trip for a while, and the next thing you know, the mom caved and gave the kid the car, and that was just an explosion. Stuff like that is not good. You really have to respect each other's, agree on boundaries together. The one thing we do say too is figure out boundaries, and you don't have to do the most harshest boundary first, but agree on what you want to impose. And then both of you have to be sure you're going to follow through. It's just not okay to have a boundary. We're going to do this, we're going to do that, and then they start, breaking down and caving in. That's not helpful. The child gets confused, and they feel like they can walk all over the parents then.
now, do within the craft framework, both of the parents enter counseling as well?
Well, the craft is, yeah, it could be a counseling program. It just depends. I mean, therapists use counselors. Therapists use craft. And yes, it could be both parents. It could be just however they want to do it. There's no set. It started really with Dr. Myers way back several decades ago. And he really was looking at the wives. He started with, men that had alcohol issues. And he realized we have a whole asset here with these wives, and we can start working with the wives and training them on how they can work with their husbands, talking to them differently, being looking at the problem in a little bit different way. And so that's how it started. And then really I think the Center for Motivation and Change is the one that came in and sort of took it then more to parent. I mean, they do husbands and wives too, but parent, really focusing a lot on parents, because I think with this fentanyl and all that's going on, a lot of families are seeing young people, so it's parents that are really struggling. But I mean, spouses, so it can be anyone. And then we do groups as well. Like, for example, in ours, it would be a group, and fathers. And I mean, I love it when parents come together. I encourage my groups to have parents that come together. Unfortunately, that doesn't happen very often. It's usually the moms that come,
Yeah.
but I would love to see the dads. And I tell them every time, please invite your, your spouse or your partner, your child's father, whoever, whoever to come, because I think it's helpful to have the dads involved.
And the reason is because if you're approaching this disease
Mm,
that has infected the child, and you're coming at it from the perspective that we need to treat this disease holistically, because this substance abuse didn't happen on its own. In other
right.
words, that the overuse had something to do with some sort of stressor that was happening continuously in the child's life. In my own personal view, I mean, I have two siblings, and both of my siblings and myself, we all suffered
Mm,
from some sort of addiction.
mm,
I was an alcoholic. My little sister was an alcoholic. We both got sober, and then she ended up, unfortunately, getting injured and hooked on opiates,
mm.
and later died of an overdose based on that.
Sorry.
And then I had another sister who manifested her stress by overeating, and that is something that I've seen more and more, at least in my practice, is sugar abuse, and people using sugar for the same reason that they would use cocaine or any other chemical, and it's to get a dopamine rush for. I'd like to call it the dopamine desert that I grew up in my house, and
Mm,
it was I won't say it was a house of horrors, but I have my own psychiatrist friend of mine who he thinks it's remarkable how well I've performed with the amount of cortisol that has been in my brain
mm.
for many years. So from that perspective, I can see how families can affect their children, and how parents can affect their children. Do you think that it's important for mom and dad to work on their personal relationship, and in order to even in order to make sure that they don't continue to sort of trigger or facilitate the substance use disorder in their child?
Oh, absolutely. I think it's very important. I mean, I think that you want to, you want to look at the problem, but also you want to look at what you're bringing to the table. I mean, if you're in your situation, that was very difficult. I had two older brothers. My dad was married before he married my mom, and his first wife was had a very difficult, strong alcohol problem. And I know my two older brothers really, I mean, to this day, I still, they're both fine. Luckily, they never went down that road. But my one brother, especially, it always comes out. He always brings up and talks about it, and I can tell it's still, and he's in his early 80s now, and he's like, they're quite a bit older than me, but yeah, and it still comes out for him. And so, it affects everyone. But yes, I think parents need to do their work. They need to make sure the relationship, I mean, sometimes kids get stressed because the marriage is not going well, or, parents are fighting all the time, or that kind of thing. So you need to, I absolutely feel like parents need to, as I said, have compassion for themselves, but also look at themselves and look at what's going on here. What are the dynamics in the family? What role is everybody playing? How did the siblings come in? I mean, I had one family who I felt a little bit like there's four kids, and this kid seemed to be a little bit singled out, even by the siblings. And we talked about doing some work on that. How can you look at that, look at him a little bit differently, and try to include him in a different way, and not sort of put kids, sometimes kids I think get put in a box in some ways, and then they can't quite get out of there. But yes, I totally agree with you. I think that parents have to be the role model, first of all. And when you don't have parents that are a healthy role model, and just the situation you described, it's very difficult to expect your child to be healthy and make good choices when they're seeing mom and dad or not. And that's one of the risk factors, as I'm sure you know, is that early use environment. You're
Mm,
seeing it all around you, and that kind of
right.
thing. So yeah, definitely, I agree with that.
Especially with younger kids, and speaking about the environment, I've read a lot about addiction, obviously, and there's always the topic that comes up of the three N's, and which is nature, nurture, and neighborhood.
Mm,
In other words, if you grow up if you grow up and your parents or your grandparents or whatnot have had alcoholism in your past, you could be genetically predisposed to it. If you grew up in a neighborhood where people use drugs and or alcohol to cope with problems, and if there's alcohol and drugs all over the place, you're more likely to suffer from substance use disorder. And then the most important one for me being an Irish person, is whether or not your family has used alcohol and or drugs, particularly alcohol, to deal with all of life's trials and tribulations.
Right.
And so do you counsel, with, because it's difficult in a situation where you have like a 16, 17-year-old kid in a family unit that drinks alcohol, and all of a sudden you're telling family, you're going to have to curtail your drinking. Do you have any advice for families in situations where they might be making some changes in their lives as well?
Yes, and I know, I mean, I haven't really had any parents where I really realized, oh, we've got a really serious problem with you right now, that I could pick up. But then again, a lot of my call, you don't know everything about what's going on. But yes, and one of the things when I actually put my older son did his intervention, we were told, and it's kind of interesting, we were told, stop, we were social drink, have a glass of wine here and there. They said, stop drinking for 3 months, because then you could look at your relationship with alcohol. So I thought, great, that's a great idea. It was sort of interesting to see different people's reactions to that. I mean, it's like, oh, really?
I'm definitely to get that death scare. Like, what?
What? I know. So, I know. And why? But I think that, I agree. I thought that was excellent. And I do relay that to parents. I think it's really good to, if this is what the situation is, and it's, to stop yourself and take a look at it. And then also to, when you're like, if your child's coming home from treatment, I mean, that's a whole issue too. Let's not have alcohol sitting around the house where it's easy for them to you need to stop or get rid of it or put it away or hide it or something, and just take a break. And I think it's important too for when they come home. I remember when my daughter came home early. I think it's really important, even if you're having a holiday, and some people are still having a glass of wine, but at least somebody, it usually was me, but someone in the family, and hopefully more than just one, you don't drink either. I mean, we just all take a break for a while, and so that they don't feel alone. It's difficult for those first few weeks, months, to just feel like, you're kind of embarrassed or whatever. Not embarrassed, but they're new at this, and it's difficult. They just kind of have their training wheels on. So I think parents should look at themselves. I think they should think about I definitely think parents should need to look at the substance uses, because if the parent doesn't look at it, then you can't really expect the kids to. I mean, it's just, it's difficult, it's depending on the age, but still, it's hard. Makes it just more difficult, and it's not healthy for anybody.
Is there any different approach that is taken within craft based on what substance is abused? In other words, if you have alcohol, if you have stimulants, or if you have opiates, are there any different modalities that you use?
I don't think there really is. I mean, I think the whole idea on craft is it's the psychology of change. How do you make someone change their life? And so I've not really seen anything where if it's alcohol, you do this thing, I mean, there are therapies. I think I'm a coach, so I'm not a therapist, but a therapist might get into that a little more, specifically on a certain substance. They probably do. In my groups, we pretty much are looking at, here are the concepts. How can I work with my child to change, my young person, my son or daughter? And it's really, it really is. It's basically the psychology of change. How can you motivate someone? How can you influence and help them motivate themselves really to want to change is really where we're headed here. We're trying to get the young person to feel that inner motivation to want to change themselves. And so that's really what craft's about, more than the individual. But like I said, I would think in therapy, they probably do a little bit more of that.
Because in the intervention space, with the widespread distribution of fentanyl in every drug, it really has become a time is of the essence when it comes to, because when I used to ask parents, what is it that he's taking, and if it was opiates, time was always of the essence, as you know, because they could overdose in a second. That's what had happened to my sister.
Mm-hmm.
But with stimulants, there was sort of time to prepare, and it was a little bit different. And then in alcohol, you probably had a little bit longer because you're not going to die of cirrhosis for a
Right.
long time. I mean, albeit that you don't go driving a car, but the immediacy really isn't there. However, I have had so many kids relapse in the past 3 years over coronavirus and whatnot, and end up dead from fentanyl, and they were using stimulants. They were using powder cocaine.
Mm-hmm.
And these are people who are not opiate addicts, and there is a distinct difference between those two types of addictions. It's seeking comfort for totally different things. One is anxiety, and the other one is depression, really. So in the intervention space, there is a different time period, I guess, or clock that we have when it comes to stimulants and with alcohol. Um, but I with young people, I guess it would be much more important for the family itself to deal with or to begin asking questions of themselves about their own substance use. And the substance that I'll really be talking about would be alcohol in the family, because when I came back from rehab, uh, I don't. I was 36 years old. My parents were no longer my parents, and I had to explain that to them. I'm like, you're my mom and my dad. You always will be, but I'm not your child, and you're not my parents anymore. And I had to do. I had to lay the foundation of where our relationship was going to begin again. Um, and but I didn't have to move back into their house. So I
Mm-hmm.
would tell them, you know, I would love to come for dinner. And my mom would say, can you come for dinner? I'd say, yeah, I'd love to come for dinner. And she'd say, okay, but can I drink? And I would say, well, it would make me a lot more comfortable going to your house and having dinner if nobody was drinking. And then my mother would say, but I really want to have a drink. And I'd say, well, you can have the drink, you just can't have me and the drink. And so my mother would say, well, you're being a jerk to me. so,
Yeah, that's so
so
hard.
in yes, it
That's
really,
hard. That's a
essentially,
tough one.
I wish I had you 15 years ago. But and the same thing happened with my dad. My father and I didn't talk for the last 10 years of his life,
Mm.
because my dad, for some reason, always wanted to talk to me when he was one glass of wine into his evening. He really needed to reach out to me and talk to me and tell me all of the stories. And I would just say, if you could do me a favor and just call me an hour before you're starting to drink rather than after, that would be great. To which I was told I'm a no good jerk because of that. And yeah, so
Oh, that's
we had,
hard.
yeah, it is
That's
difficult.
tough. That's really tough.
And so what I think that you're doing is I think you're helping parents correct behavior like that, but really ending a lot of generational pain and a lot of generational addiction and generational trauma. And so can you do you have any examples of sort of long-term recovery of not only a person of care and a young person, but also how a family transformed through craft and through your assistance?
Oh yeah, sure. I mean, there are many families who, I'm trying to think of one necessarily right now that, yeah, they had a child who they had sent out. She used to call it. He went camping for long periods of time because they had kicked him out of the house, and they finally went, and they were looking at themselves and what was going on with them. I don't know that they had a drinking problem, and I will be honest, Ron, I don't know that I've had a family where I would say for sure they had a drinking problem. I mean, like I said, I know that that's very, that's a common thing. I mean, I'm not saying it's or not. I don't know if it's a common thing, but in some families it happens. So I haven't felt like I've had to step up and say, we need to really work on your situation first. What I do think is parents have to look at how they're handling their kids and think about how what their response is and that kind of thing. But this mom went and got her child and brought him home, and they all started working on different aspects of the problem and how they could work together, and she could, kind of calm everybody down, and what their boundaries were. I mean, they really needed to work on how to set some clear boundaries and to follow through and that kind of thing. But yes, I totally agree, and I just want to say one thing. We do, if you do have, as you said, the fentanyl and the opioid is very stressful, and we do recommend. I'm like I said, we run groups. If there's an emergency, definitely reach out to somebody like yourself, an interventionist. If you have an emergency situation where you need to, it's life or death, then yes, definitely reach out to somebody. I'm not sure. I'm not an interventionist, so I'm not in that role, but. Definitely that's an important thing. And I totally agree that families, a lot of times you just need to look at the whole structure. And I will say one of the hardest things for me, honestly, is when I see the dads, and again, first of all, let me say there's many wonderful dads out there, but I do see a number of absent dads who are not there, who aren't involved. And I think, through divorce or they have their own substance use or whatever, especially for sons, it's just painful, very painful. So they, maybe don't see their dad anymore, or their dad's remarried and moved on. I mean, I see some of that, and it's really hard. And you can see why this, and I think like I said, I've read that it affects sons, it affects both sons and daughters, but I think it affects sons even more strongly than daughters. So those are the kind of things, but it's hard because I'm really working with parents trying to promote this change, motivate your child to change. But I do always recommend, if I feel like there's any issues, that they go to therapy. I think this is when a therapist really would probably need to come in and work with them and dig into these real difficult issues, and that have gone back maybe generations, and really try to start changing things around. So yeah, for sure.
Yeah, I would agree with you in my own personal experience that dads tend to have a particular issue with their own sons, and I have four daughters, and I treat them. Do I treat them differently than my son? Probably not, but do I? It's sort of an expectation. I expect more out of the boy for just some things.
Yeah.
Then and my wife would tell me that I coddle. Or I coddle them. I love them to death, and they're so pretty. So I just can't myself. So I'm softer with them,
Right.
than I am with the lad.
Mm-hmm.
And my wife, every once in a while, she'll say, "Why?" And I say, "Because he can break more things than they can." And she says, "What?" And I said, "Yeah." And I'm like, when they were in prior to about like 13 or 14, my sons and my daughters were completely the opposite, where my son from 0 to 12 or 13 was a complete basket case. He would bump into things, he would smash into walls, he cut his head open, he was at the hospital more. He just was not together. And my daughters, every one of them was structured, the room was clean, everything was fine, and never went to the hospital. And then the teenage years came, and then everything flipped.
Mm-hmm.
And then all of a sudden, I wasn't all that worried about my boy, but I'm really worried about my daughters. Because now other men think that they're cute and pretty too.
Mm-hmm.
And that was my problem with my daughters. But I do agree with you that with sons and dads, there's a different dynamic, and I've seen that with my own dad, and I also saw that in my own practice, that I have, mom's approach is a heck of a lot different from dad's, and dads, especially with their boy, they really seem to want to take out that stick, and mom, boys and girls, it doesn't matter. It's carrot, 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 carrot. Please, I'll give you candy. Please, I'll give you candy. And that, and I try to explain to them is when they were growing up, you might have been a little bit too much carrot and a little bit too less stick. However, right now is not the time to come down with the hammer and start pounding people, because I don't know in your own practice, but in mine, and I don't do therapy. I'm not a recovery coach because I'm a criminal defense attorney, and a lot of times people do have criminal cases with their substance abuse, and it becomes a dual role.
Right.
So I don't I don't do that. But so in your practice, do you have any experience like that?
Sure, where the dads are coming down harder. Yeah, absolutely. No, that's very common, and so I kind of say, there's a happy medium here. We don't want to be a cheerleader for just like, oh, you're wonderful no matter what you do. And then the other thing is you don't want to be so harsh that, you're not really understanding. So I think it's really helpful. And I think that, and the dads that have gone through the program actually have really liked it, which has been nice. It's again, it's the center. I did not write this, but it's the Foundation for Change and this Invitation to Change group. And when they go through, it's a 12-week program that we do. And when they go through it, they really, I think they really get something out of it. They realize, and actually it was funny because I did have one parent just recently, she said their therapist said the dad was going to Al-Anon which was fine, but there's that kind of tough love type of an approach, detach. And so their part of the therapy was he had to come, she had to go to his program, but which is, I think is actually really good. And he had to come to the Invitation to Change. And I'm not saying that we're just all carrot at all. I think it's a happy medium, happy balance. We want to encourage, but we also want to hold our kids responsible. And when you plan ahead and sort of think about these things, I think that's one of the key things that I've really learned. Then you're calmer. You can give your boundaries. You can say these are but you're not screaming and hysterical because you've thought about it before. You're keep trying to just keep things under control a little bit. But it helps for parents to just think about all of this stuff before the incidents happen as much as you can. I mean, it's not always predictable, as things happen, but yeah. So I think it's very helpful to work with both of them. And again, I've had parents who, I've had moms who really are strict and are so frustrated with the dad, because the dad, they like I said, that one mom, the son calls the dad and he'll let him do whatever he wants to. And it's hard on either side, it's not okay. It's not okay. You got to work together.
So, do you, because we have, normally is that you'll have dad as tough love and I want consequences for this immediately. And then normally unlike in that situation, most of the time it's a mom saying, oh, don't beat him. Oh, don't spank him. I mean, and that's what it is. It's like, every once in a while my 5-year-old does something and I just got to give her a little pop on the booty and my wife cringes. Yeah. And I just say, it's not hurting. Mm-hmm. It's just saying because I told her, if you do X, Y is going to happen. Mm-hmm. And my wife has a lot of trouble with when the child goes and does X, that you have to apply Y. And if you don't, the kid is going to know that you are full of beans and there are no consequences. And therefore, if there aren't any consequences, there are no boundaries. There is no therapy. We haven't really done anything. So how do you get, I'm not saying it's mom or dad, but how do you get easier, softer approach parent to actually apply those consequences? Are there any techniques?
Well, yeah, we talk about it a lot. The boundaries, again, you have to really be clear. Again, let your child know as you're doing, let your child know if you do X, you're going to do Y. But then again, you have to follow through. So what we do say is really it's better to not, I mean, honestly, if you're not going to follow through, then don't set the boundary. Be really clear with yourself what boundaries, and everyone can't, sometimes parents have to work up to being a little more, maybe more strict, I guess you would say, but you want to start small if you have to and set things that I mean, I guess what I'm trying to say is the key here is following through. So whatever you say, I don't say to parents, you need to say this, you need to do this, you need to do. I say, you should do, your child. You know your child better than I do. Most of these kids, I've never met them before. It's just the parents I'm working with. But you want to set a boundary that you're clear that you're going to follow through with exactly what you said, because the child will just think, well, I can just do whatever I want to because I can get away with it. There's no consequence. So the idea is if there's no consequence, there's no reason to change. I mean, that's really the key, and allowing the consequences too of letting their child, so say they sleep over and miss their test at school because they can't get up. Well, you don't go solve it for the kid. That you send the kid to school and tell them to figure it out with the teacher. I mean, you don't jump in and make sure everything is corrected. We deal with that with legal issues. Again, this is a parent's choice. Some parents run in and bail their kids out immediately. Others feel like, and we sort of say, if you're going to go handle and that this is your area, but, it's a parent's choice. But if you're always solving everything for your child, there's no reason for them to learn. And one of the phrases they use is the world can be the teacher. Let the world be your child's teacher, and it helps. All these things are very important to think through, and you want to think about what's going to motivate your child to want to change. And when they feel the negative consequences, that's going to be a motivator for them to think, okay, maybe this isn't so good. But it's difficult for parents, especially moms, probably, for them to see their children in pain. Even if their child's 30 or 35 or 40, no matter what the age, it's hard. It's hard to watch them struggle and not say, well, But the only other thing we do say is that keep safety in mind. If you think there's something where your child's really going to be unsafe, then, maybe rethink that consequence, or see what you can do to minimize it a little bit. But for the most part, you want to really set clear boundaries and let the consequences happen.
So as I really want to thank you very much for being on the program. And I always like to end these with some practical advice. So if there's a parent out there listening, and they have a child who they know is abusing alcohol and or drugs, what kind of advice would you give them to begin to deal with that for the first time? So we'll assume that this is somebody who's never had any experience with this, and all of a sudden they go into their child's room and they open up that bag and they find, and this has happened to me a lot in my career, and they find a bag full of heroin.
Right. Exactly happened.
What do you do now?
Right. I should say that exactly happened with me. I didn't find heroin, but I went in my child's backpack and there's the drugs, so I know that whole thing. So yeah, my advice would be to just reach out, bring a professional in as quickly as you can. This is really a problem that I don't suggest parents try to solve on their own. So you could bring if it's a teen, you can bring a school psychologist in, a therapist, counselor, that kind of thing. I would also look at groups. I think groups can be helpful. There's Al-Anon, Smart Recovery, Invitation to Change are three of the main groups. Peer support can be really helpful because you're going to hear what other parents have to say and you're going to learn from them. And then I also think as time goes on, I like to call it kind of a patchwork. I picked this up from somebody else, but a patchwork approach. So picking out, like from the Al-Anon meeting, you might pick out certain things. From the Invitation to Change approach, you might pick out certain things in Smart Recovery or whatever you're doing, or from the therapist. So it helps, I think, to kind of create your own approach, your own recovery approach for your child on what makes sense for your family. But there's lots of resources out there. If you go to the Foundation for Change site, they have videos, they have books, they have my book's available, but they have Beyond Addiction and some other books out there that are helpful. Lots of trainings. I would highly recommend anyone get a hold of the Foundation for Change too, because they have Monday trainings at lunch with psychologists. I mean, there are lots of different things. Cost is minimal for many of these things. They're not that expensive. But then getting a family, I think for people with teens, especially, family coaching can be really helpful. All three of you go where the family goes. I think it's really helpful. So everybody's looking at their role and we're not setting the person with the addiction or substance use issue over here and everyone else is over here and doesn't have any problems. You need to bring everyone together and we all need to look at what's going on in the family. Why is this happening? And what can you do to help solve the problem and get things on a better track. And I also would say to parents, know there's hope. There is hope for your child. Many have recovered.
Yeah.
Right. Yep. And yes, there's tragic stories out there too, but many have recovered. I would say most do figure it out at some point, and turn themselves around. So, but it's tragic.
I get a lot of people and a lot of moms, and they'll look at the data. and
Mm-hmm.
they'll go and Google the data. And I try to tell them, Googling the data on this stuff is like Googling, I have a spot on my face. That is a terrible idea. Don't do that. Don't Google spot on my face. What does it mean? Because it will tell you that you're going to die tomorrow. Because that's what the internet does. I tell people all the time, the internet is there it's designed to excite you one way or the other, negatively or positively. It is designed to excite you and to get your emotions going. So don't Google anything. And I would like to thank you for being on the program, and I would like to encourage everybody to read The Compassionate Antidote. It's been a pleasure speaking with you. And I was wondering, do you take personal clients?
I do. Well, first of all, thank you, Ryan, for having me. I really appreciate the invitation. And yes, I do. I do groups more right now than I'm doing individual, but I do individual clients. If somebody wants to reach out, feel free. I can walk them through the program. Or just see where they are and what strategies we can use to help them feel better and try to move them forward. And also, I have lots of resources. That's the other thing that can be helpful. If you want a strategy session with me, sometimes I have resources of different places you can go or different people, to help you too. So, yes.
Because I have a number of they happen to be moms, but
Mm-hmm.
I have a number of moms that with the dads, I can just tell them 1, 2, and 3, and they'll go, okay, fine, I'm all set with it. But moms seem to need a lot more hand holding and comforting, I guess it is,
Mm-hmm.
because they need reassurance is
Mm-hmm.
really what it is. Because I do like to think that my relationship with my children is the same as my wife's, but my humility tells me that it's not, and that I did not pass these human beings through my body, and it is not the same thing. And so I'm very compassionate with moms in particular, and I think that I know a lot of them that would benefit from reading your book and also engaging with you one on one in some counseling. So if you don't mind, I would love to recommend you to some people, one specifically in particular that might call you today. Uh, yeah, so because I have a particular issue right now that is right up your alley. And so,
Sure.
with all of that, I want to thank you very much for being on the program, and I hope to keep in contact with you and watching your success.
Well, great. Thank you so much, Ryan. I appreciate being invited to your podcast. Thanks so much.
Thank you so much, Kathy.
Okay.
Bye
Bye
bye.
bye.